Today's topic will be medical and social rehabilitation in pediatrics. Cerebral palsy implies an insult of the developing brain that produces of disorder movements and posture. Primary symptoms of cerebral palsy are problem with muscle tones, balance, selectivity, and strength. Rehabilitation of children with a palsy aims to reach and maintain optimal physical, sensory, intellectual, psychological, and social functions. It includes providing the tools an individual needs to gain and maintain independence and self-determination. Cerebral palsy are neurological disorders, not just one condition, and all can cause some degree of disability in movement, balance, and posture. Cerebral palsy is the most common movement and motor disability in children. One is in approximately 345 children has cerebral palsy. About 80% of children with the condition have spastic cerebral palsy, which causes increased muscle tone. And more than half of children diagnosed with cerebral palsy can walk independently, and most children with cerebral palsy have other conditions. For example, in children with cerebral palsy can be such problems as an epilepsy. So this is the common co-occurring condition, and very often this is disorders can be present in case of cerebral palsy in childhood, and it will have some effect on rehabilitation program in such children. And the main cause of cerebral palsy is brain damage that occurs in a developing during birth or fetus. Cerebral palsy is more common happens in boys than in girls, but it's very often happens in childhood. Cerebral palsy is a group of neurological disorders. In is this disorders affect the motor and developmental skills. And according to the Center of Cerebral for Diseases Control and Prevention, about 1 in 345 children in the United States have been diagnosed with cerebral palsy. Cerebral palsy is a group of disorders that affect normal movement in different parts of body, and this condition can cause problems with posture, for example, manner of walking, so it will be gait problems of such patients. Muscle tone, so it can be increase the muscle tone, or in case of the problem with pyramidal tract, in case of the central paralysis, and can be problem with coordination of movement in case of the lesion of the cerebellum. The word cerebral refers to the brain's cerebrum, which is the part of the brain that regulates motor function. Palsy describes the paralysis of voluntary movement in certain part of the body. There are several types of cerebral palsy, and they all have their clinical pictures, and it depends on the localization of brain injury. And symptoms can vary depending on when how badly the brain was damaged. The type of cerebral palsy include, first of all, this is ataxic cerebral palsy. This type of cerebral palsy caused by cerebellum damage, resulting in a problem with motor control and movement. For example, it will be the gait of such patient or of such children will be the drunk like the drunk people gait, and will be ataxia. Next, it will be a problem with Romberg test. They cannot stand correctly, they will fall down. And it will be problem with dynamic ataxia and static ataxia. Static ataxia, it's problem with the standing of the patient and gait of the patient. But dynamic ataxia, this will be incorrect movements of the distal part of extremities in our hands and legs. For example, finger to nose test, heel to knee test, problem with writing of such patient, scanning speech of such patients, nystagmus, and other problems. Another type of cerebral palsy includes the attitoid or dyskinetic cerebral palsy. This damage caused by basal ganglia or cerebellum damage, and the symptoms include different changes of the muscle tone. It means it can be fluctuating muscle tone and involuntary movements. It means it will be different movements in extremities of such patients, attitude movements, for example, like the piano play movements in extremities in the fingers can, for example, yes, and another type of cerebral palsy will be hypotonic cerebral palsy. This is a rare type of cerebral palsy, and this type caused by cerebellum damage, and it is characterized by the floppy muscles, excess flexibility, and poor mobility. The most common type of cerebral palsy is the spastic cerebral palsy, and it's a type of cerebral palsy caused by damage to the motor cortex or pyramidal tract, and characterized by increase of the muscle tone of the central types like the clasp knife, and yeah, very often it happens in lower extremity paraplegia will be, and mixed cerebral palsy. This is multiple area of brain damage, and it can cause patients to have more than one type of cerebral palsy. Spastic cerebral palsy accounts for 75% of all cases. It causes increased muscle tone, known as spasticity, and another symptoms of such disorders. For example, delayed development milestones for moving, abnormal movements, movement inhibition, stiff and spastic muscles, difficulties controlling muscle movement, problems moving from one position to another, spastic quadriplegia impacts the child's upper and lower limbs and body, severely restricts mobility. Spastic diplegia only affects the lower half of the body. It's the most common type of this disorder, and it will be problems with lower extremity very often happens, and many children can still walk with some impairments and may need assistive devices such as walkers, for example. And spastic hemiplegia affects one side of the body only, usually the arm more than the leg. Most children with hemiplegia can walk. Dyskinetic cerebral palsy is the second most common type of cerebral palsy, and symptoms include dystonia, repetitive and twisting motions, attitozing. Next, it can be present right movement. Next, poor posture. Poor posture, painful movements because, for example, of increase of the muscle tone, and next it will be difficulty of swallowing or talking of such patients. Next, uh, next will be there another type of cerebral palsy. It will be there ataxic cerebral palsy. This type of cerebral palsy is the least common, and it causes poor balance and limited coordination. Next, it will be their tremors, for example. Next will be the snaky movement and the difficult to control. Next, mixed cerebral palsy can be present too. Is another type of cerebral palsy. It will be causes it's it includes the causes of the symptoms of the damage of different types of nervous system, and it affects the clinic picture or of 2 or 3 type of cerebral palsy. And next, it will be there, for example, spastic dyskinetic cerebral palsy is the most common type. So it will be involve the cerebral palsy of a different type. For example, the spastic increase of the muscle tone and spasticity, and it will be the dyskinetic movements in such children. So will be the mixed type of cerebral palsy. Common cerebral palsy causes include, first of all, will be the bacterial and viral infections, such as meningitis, bleeding in the brain, for example, hemorrhaging, a head injury, which happens during the birth or within the first year of infancy, lack of oxygen to the brain, asphyxia before, during, or after birth. Prenatal, for example, exposure to drugs and alcohol, abuse, prenatal exposure to raw and undercooked meal or fish. This is the most common causes. Cerebral palsy caused by medical negligence, and some children develop cerebral palsy as a result of birth injury caused by medical malpractice or negligence. The cerebral palsy cause stem from inadequate case for medical professionals during the childbirth process, unfortunately. And for example, failure to detect and or properly treat infections, for example, or failure to detect changes in the fetal heart rate, failure to schedule or perform the medically advisable C-sections, for example, and in other cases can be using improper use of delivery tools as a vacuum extractor, for example. Yes, and physical symptoms, contractions, shortening of muscles, for example, drilling, engaged. For example, the deeper graphics will be increased and will be present of pathological reflexes, floppy muscles, tone, gastrointestinal problems, incontinence, involuntary movements or tremors, lack of coordinations and balance, problems swallowing or attacking, problem with movements on one side of the body, stiff muscles, spasticity, and another physical symptoms. And neurological symptoms will be hydrocephalus can be present, behavior problems, delayed motor skill development, difficulty with speech and language, dysarthria, sensory impairment, visual and hearing impairment. Conditions that may occur during the cerebral palsy can include this is attention deficit hyperactivity disorders, autism spectrum disorders, chronic pain, epilepsy, intellectual disability, mental health disorders, speech disorders, and visual and hearing impairment. Cerebral palsy diagnosis. Cerebral palsy is usually diagnosed anywhere between 18 months and 5 years of age. Although patients and caregivers may be the first to notice signs of cerebral palsy in infants, the doctor often hesitate to make an immediate diagnosis until further symptoms can be observed as the child gets older. A cerebral palsy diagnosis is made using the imaging tests to looking for brain damage. Imaging tests used to diagnose cerebral palsy include CTs of computer tomography scans, cranial ultrasounds, electroencephalograms, and magnetic resonance imaging MRI scans. Expectant mother can also reduce the risk by avoiding alcohol, cigarettes, recreation drugs, prescription drugs known to increase risk during the pregnancy. Avoiding exposure to infections and viruses known to impact fetal health, for example, cytomegalovirus, Zika virus, controlling underlying health issues such as blood pressure, diabetes, getting routine vaccinating, underlying any potential compatibility difference in presence of red blood cells proteins between muscle and joints, which could lead to hemolytic anemia, for example. Yes. Factor affecting cerebral palsy prognosis includes difficulties eating and swallowing, impairments in vision, hearing, or speech, intellectual disabilities, mobility limitation, musculoskeletal disorders, respiratory disorders, and seizures. Cerebral palsy treatment is not focused on curing or fully correcting a child's conditions. Once a child has developed cerebral palsy, it cannot be cured. Instead, treatment focuses on nutriting a child's remaining skills to reduce symptoms and encourage an independent life. Common classes of medication for children with cerebral palsy include neurotransmitter blockers, anticonvulsants, for example, antidepressants, anti-inflammatories, reduce pain and inflammation, baclofen, muscle relaxer, benzodiazepines, treat anxiety, seizures, and insomnia, Botox, treat spasticity, nerve block, as relaxant, softeners, stool therapy. There are many different therapy options to help treat cerebral palsy symptoms. Therapy can be used to improve mobility and brain cognition. Physical therapy helps relieve pain and muscle stiffness, as well as improve balance, coordination, and overall mobility. Physical therapists will use specialized equipment to help your child move more freely and live more independently. Occupational therapy helps children with cerebral palsy learn how to complete everyday tasks and activities by improving their fine motor skills and cognitive abilities. Speech therapy helps children to improve their communication and language skills. This type of therapy gives children the confidence to learn and socialize. Speech therapy can also help children who have difficulty eating and swallowing. Alternative therapy helps children focus on themselves as individuals and let them overcome physical and mental disorders. Alternative therapy includes hypotherapy, which include hippotherapy, includes riding horses, music therapy, aquatic therapy, acupuncture, and more. Surgery may be recommended for children with severe mobility and muscles issue. Surgery for cerebral palsy can correct or improve issues with movements in the legs, ankles, feet, hips, wrists, and arms. Muscle, tendons, bones, and nerves are operated on to improve movements in this area of the body. Cerebral palsy surgery can correct flexed joint and tendons, correct foot deformities, correct muscle contractures, correct spinal scoliosis, improve balance and coordination, improve posture, prevent hip dislocation, prevent spinal deformities, reduce tremor, relieve pain, relieve muscle stiffness, risk occurring conditions. And also we can use assistive devices. Specialized assistive devices can help individuals with cerebral palsy that experience issue with communication, hearing, and vision. And type of assistive devices include cochlear implants, electronic communication boards, eye tracking device, typing aids, and writing aids. Mobility aids. Children with mobility limitation may benefit from assistive technology that can be adjusted to their individual needs. Mobility aids aim to help children with cerebral palsy move freely and can greatly improve their quality of life and independence. And types of mobility aids includes canes, crutches, lifts, power scooters, orthotics devices, walkers, walking sticks, wheelchairs. And you can see therapeutic approach to the management of cerebral palsy. This is first of all BOBAT or neurodevelopmental therapy, conductive education, sensory integration, adolescent aim orient management, and next advanced neuromotor rehabilitation. Biofeedback, Japanese field rehabilitation technique, electrical stimulation, early intervention, functional physical therapy, movements opportunities with education, patenting, brainwave, pelvic positioning, physical activity training, strength training, target training, water therapy, training program, 15 modalities, recreational therapy, hypotherapy, swimming programs, alternative type of therapies, hyperbaric oxygen therapy, acupuncture, and orthosacral craniosacral therapy. Brain plasticity is important to the pathology, pathophysiology, and treatment of cerebral palsy throughout a patient's life, and these features have direct reached into the functional recovery, and rehabilitation therapies can aim to capitalize on neuroplasticity are being developed. Recent recommendations state that intensive rehabilitation improves motor function in children with cerebral palsy by including motor lowering theory and learning theory. Repetitive goal directs movements can can't that associated with sensory feedback and an attractive environment are likely to promote reorganization of the neuronal pathway and motor development after brain injuries. Advances in neuroscience suggest that the central nervous system has some plasticity and the potential to reorganize throughout the entire lifespan rather than merely during a short period of development. Activity-dependent plasticity takes place in the motor complex. The concept that intense task-specific exercises capitalize on the potential plasticity of the central nervous system and thus improve motor recovery that has led to the development of several successful interventions. In general, techniques used in the cerebral palsy rehabilitation can be classified as approaches without using any equipment and approaches with using equipment. Bobat concepts, this is one of the neurodevelopmental treatment, was developed by Carol Bobat and Bertha Bobat in 14th. And the concept was based on the observations of how abnormal tone interfaced with the child's ability to develop functional skills, functional activity. And the Bobats developed a theoretical framework for practice based on the neurophysiological knowledge of the day. And Bobbitt's concepts say that the normal quality of tone is necessary for effective movement. And in Bobbitt's concepts, therapists use the specialized handling techniques that improve the quality of tone and facilitate the movement pattern in the execution of everyday tasks. Also, the active participation of the child is emphasized throughout the treatment with specific aim and controlling the activity, and quality of tone has always been central to this concept. The Bobbats emphasize the need for movement strategies leads to treatment to be carried over into everyday life activities. When planning the most appropriate activity, the therapists draw on in-depth knowledge and normal motor development and the control movement. Now I will show you some small video about our topic, and now I want to show you some small video where you will see the new important method of rehabilitation in childhood, and you can see this movie. You can see this movie, and now I will show you this small video. Wait a little. Cerebral palsy. For example, I will show you the cerebral palsy walking of the patients, and you will see you will see the very interesting movie about the rehabilitation of the patients with cerebral palsy. And for example, you can watch the walking kids with new promises in the cerebral palsy rehabilitation. So you can see this movie. Oh, yes. So you can watch the movie, how can be improve the function, and the gait, how to improve walking of the patient patient with cerebral palsy. In this case, you can watch the child with lower paraplegia. This is and with devices with mechanotherapy, and such patients can move and work. So this is the one movie. Another movie which I want to show you, this is how we can rehabilitate such patients and how we can see guidelines of the exercise of the patient with the you can see. Now I will show you. Now I will show you early intervention of cerebral palsy. So I will show you this video, 1 minute. I will share with my screen, and you can watch this movie. 1 minute else. I will show you with the wait a little. I will show you this video. On my this is the physical therapy early intervention.
I'm Scott Gorshine. This is my daughter Lucy. She's a twin. Her brother did not have a rough start in delivery. She had a rough start. And she came out not breathing, totally blue. We still don't know how long without oxygen. The hardest moments of life were at the beginning, like you were staring into a void.
My son, Gabriel Wolf, was born very prematurely. He was born at 26 weeks and just 1 pound. There were a lot of medical complications. He coded multiple times. He was diagnosed with developmental delay, and then he had an official diagnosis of cerebral palsy. We were told he would never walk. We were given a pretty bleak outlook. In the NICU, we had heard about Stacy and, everything that she was doing.
Physical therapists are central to the role of treating children who have cerebral palsy. And a large part of that is because one of the key characteristics is a motor delay. And physical therapists are the movement specialists. Early identification of cerebral palsy is absolutely crucial. And the main reason for that is because we're starting to identify interventions that are more effective when provided at a very young age. So this is a really big change that's happened, that we can start to identify the kids at high risk between 3 and 5 months pretty consistently. Young babies learn about the world by touching it. So picking up a toy helps them understand, is this toy heavy or is it not heavy? They understand the concept of heavy because they interact with that toy. Without that opportunity, because they can't use their hands well, they're not able to learn that concept. And that's a cumulative impact then over their early years, that they start to not learn those skills.
Little by little, we progressed from him being this immobile child to he was able to eventually sit and then stand and now walk. My husband and I really believe that it was Stacy's early intervention, her program, that really helped get him to where he is now.
I am a researcher who can turn off being a clinician. I think it's crucial that we work either collaboratively with clinicians or maintain clinical practice to ask important questions. The interventions that we're looking at now and that we're starting to see early evidence for suggest that if we provide task-specific interventions at a high enough dose, we do see changes in those areas of development. Since we know that motor development has a very significant impact on cognition, providing opportunities for kids to move is actually improving their thinking skills.
We started at 1 and she couldn't sit up by herself. The early detection of her CMP allowed so many doors to open for her care. And thankfully, there are physical therapists who know how to teach her with her specific situation, how to achieve things. Her world changed from being on the floor to being like you've seen her today. She already has surpassed what I thought was possible for her. There was this kind of uplifting feel to the process that wasn't just like Lucy getting her therapy, but it was also kind of like helping the family get through it and see hope and look to the future.
We went from being very scared, very scared and not feeling, just not having a lot of hope. To what we have now, and it's... Mama. I think I'm just so grateful to Stacy, to her team for working with us, for being patient with us, for teaching us so much. And I think that made all the difference in the world.
Yes, I'm Stacy. Very good.
So you saw how the early interventions can help to patients with cerebral palsy, with children with cerebral palsy disorders. And now we will continue our presentation, and we will discuss another questions about their rehabilitation of patients with cerebral palsy. So we will continue our presentations. Next, what I want to talk so about the boba therapy concept and about this therapy. This neurodevelopmental treatment aims to normalize muscle tone, inhibit primitive and abnormal reflexes, and to facilitate normal movements. The Bobat concept, based on the system approach to motor control with neuroplasticity as the primary mechanism for neurological recovery. Bobat concept can help to improve their normal reflexes of the children and to inhibit abnormal reflexes, which allows active participations in practice for functional skills using handling, and the therapist aim to facilitate and the desired muscle actions. Through this handling, it is possible to conduct movements, influence muscle tone, and improve posture, position, and posture self-organization. Self-organization facilitates posture and movement integration and allowing the use of posture control strategies, contributing for motor learning and motor control improvements. Normal movements are facilitated, but abnormal patterns are inhibited to allow appropriate reactions. And what I want to so the aim of the therapy goal attainment therapy. The aim of the therapy for children with cerebral palsy, as for most children with developmental disabilities, is to facilitate the child's participation in everyday life situations and to communicate with their parents, brothers, siblings, and to move from one place to another, to dress and undress, to eat and to play. And the choice of goal for therapy is dependent of many factors. The child linking to and the family's preferences, the society and environment in which family lives, and child's degree or disability. Today, the child is given the possibility to be more an active problem solver, and the treatment, this treatment approach refers to the task-oriented approach and to build as a build on theories of motor control. Next, it is in this context in which the goal for therapy are set in close collaboration with the child's family and sometimes also the child. The goal are especially there grading the goal for and steps provide the individual plans for children to learn and specific activity and reach the goal. Thus, it is important to integrate the principles of motor learning and the treatment concept and adapt the principle of all this for should be specific for each child. And cerebral palsy is very, as you saw the clinical picture, heterogeneous. Light differences exist between children. Because of this, there are different conceptions and different it will be should be the individual for all the child, because for example children with disabilities of with one problem, it can have one method of rehabilitation. And for example, I will show you occupation exercise for children and with arm stiffness. And you can watch this small movie about how you should work. And with Sebastian, this Sebastian has this spasticity of muscles, and you can see this is the movements. How can we work with such patients? So the small video.
I'm here with Sebastian, and Sebastian has spastic quadriplegic cerebral palsy. He is 6.5 years old, and we are here. Tell him about it. You're right. We're working at Child and Family Development. Yes, it is where I'm employed, and they're nice enough to let us come into the clinic today to work. The next thing I hear lots of questions about is how do you loosen up stiffness? And a lot of times the questions people ask me are particularly about arms. For me, one of the easiest ways to work on reducing tone in arms is to actually put weight through the arms and hands. So I have them set up here on my lap, and I can get one hand down on my leg to get weight bearing through the hand. I got it open here on my first try. I have some children who are so stiff, trying to get this demonstration, that I cannot get the hand open on my first attempt. So if I cannot get the hand open, I'll weight bear to start off with a closed or fisted hand. And then after weight bearing, I tend to be able to get a looser hand to be able to get it open. One of the things I also do is I tend to break the hand back to get those fingers open. A lot of times I don't have a free hand, so I just have this one arm to be able to get that hand open. So if you see how I brought his hand back over my leg to be able to try to get that hand open. The other things I really try, if you'll notice, I've got kind of a 3-point control with my right arm. I've got his wrist, I'm holding his elbow, and I've come over his shoulder, so I'm really trapped that right upper arm. The other thing I'm doing is I'm trying to get his hand underneath his shoulder, so I'm getting weight bearing straight down through it. I can spread out a little bit, I can come in a little bit, but I'm just getting weight bearing through that arm. Obviously the same thing on the other side. So I hope that weight bearing through your child's arms is an easy way to get those arms to loosen up a little bit. I hope this is a good idea. And I'll see you next time. Thanks a lot.
So you saw there some patients with cerebral palsy and how the occupational therapists, physical therapists use different methods to help them. Next, what we will talk about, it will be there about the robotic devices which can be used in this therapy. Robot-assisted therapy. So this is another very important part of rehabilitation of these patients, and robot-assisted therapy is conducted using robotic devices that enable the patients to perform more specifically movements. The main interest is in using robots is to allow the patients to achieve a large amount of movements in a limited time. So this is very effective and important type of therapy. Additionally, the interactive human-machine interface has the capacity to motivate the child to perform more his and her therapy throughout playful games such as car races, or to perform exercise that mimic devices. Moreover, robotic devices allow the patients to receive visual, auditory, or sensory feedback. And finally, the robot gives performance-based assistance to the patients. And these assistants can enhance the neuronal plasticity by help patient to make different movements as actively as possible. And the strength of robotic therapy is based on repetitive, goal-oriented cognitive engaging tasks, which appear to be particularly interesting in the pediatric age, when the neuroplasticity is recognized to be its maximum. Robotic therapy might increase the functional strength and improve isolated movements. Several groups reporting long-lasting improvements in standing and walking in children with cerebral palsy. Also, parents and patients report improvements in terms of quality of life. A device especially developed for locomotion training in the Lokomat make two active orthoses and weight-bearing system in a treadmill. This robot rehabilitation has proposed to improve walking and physical fitness. It is reported that the muscular strength of ankle, dorsiflexion, and plantar flexion increases in children with cerebral palsy who played a block break game and airplane game using robotic and in virtual reality 3 times per week for 12 weeks. Robotic devices offer children fun and intensive rehabilitation that the human therapist cannot provide. These robots can be easily integrated as a relevant complement to therapy in the clinical setting. Studies have shown that combined passive and active training using a portable robot for children with the cerebral palsy is effective and in laboratory and in the clinical setting. Repetitive goal-directed biofeedback training throughout motivating games in the laboratory and in the home environment is possible, and a robotic guided therapy can be an option for home-based treatment program. And the benefits of home-based robot guideline therapy is also similar to those of laboratory-based goal therapy. Next part of rehabilitation is virtual reality. So virtual reality can be defined as the use of interactive simulations created with the computer to perform users in virtual environments that appear, sound, and feel similar to real-world objects and events. Users interact with the virtual objects by moving and manipulating them. And the therapeutic aim of virtual reality and interactive computer play are to provide users with both an just and entertaining experience. And the use of virtual reality in pediatric rehabilitation is based on its distinctive attributes that provides ecologically valid opportunities for active learning, which are enabled and motivating yet challenging and safe. Due to limitation in mobility and manual ability, children with cerebral palsy may have fewer opportunities to free play. Without opportunities to self-initiated and spontaneous play, children can develop allergic capsules and assume that they are unable to perform a task even though they may have the required physical abilities. What I want to add that in another very important thing, this is the cardiorespiratory training can effectively increase the cardiorespiratory system in children and young adults with cerebral palsy. And exercise prescription for people with cerebral palsy should include minimum frequency of 2 or 3 times per week, the intensity between 60 and 95% of peak heart rate, or between 40 and 80%, or minimum time of 20 minutes per session for at least 8 weeks during 8 weeks, and 3 times per week, or 16 weeks with frequency 2 times per week. This is very important time of rehabilitation. And next, what I want to show you, I want to show you a small video about the rehabilitation in children with cerebral palsy, and how to make some, for example, trainings with such people, and cerebral palsy, and using different exercises, and for example, how to sit and to, for example, reaching the with patient with cerebral palsy, and how physical therapist has not only to do different exercises with physical therapist and with occupational therapy. We are talking about the how, for example, encourage. I will show you a small video how to and encourage how to encourage such patients with to make their voice this. I will show you. 1 minute, please. I will share with my screen to show you this all these things. 1 minute, please, because this is so please, now I will show this video. And physical therapists should encourage the patients to do different exercises because it's very important. So this is the people and how physical therapists work with patients outside their, for example, and how it's work with these patients. So please watch this movie.
And co-instructor. His name is Sebastian. He has spastic quadriplegic cerebral palsy. And we're working on reaching today. And one of the ideas we're doing to work on reaching is to have him hold something with 2 hands. I found that something smaller was a little bit better than something bigger. But you want something to be light, and then you put something up for him to reach with 2 hands to knock. Get it, Sebastian. Nice. Way to go, Sebastian. Come on, let's get centered again. Let's go again. Yeah. Get your arms ready. You're going to hit it. You ready? Got it? Okay, Sebastian. You got you hit it. Uh-oh. Sebastian, you leaned back so you missed it. You got to keep your grip on it with 2 hands. You ready? Here we go. 1. Here, let's open up that hand. And you see how I push down his wrist to open up his hand? I'm going to push down his wrist to open up that hand. And then when you cock it back up, it makes it grab. All right, Sebastian, you ready? I'm going to try hitting it again, Sebastian. You ready? Hit that balloon, Sebastian. Nicely done. Good working, Sebastian. Let's try it with a tether ball next. Oh, boy. Excellent, Sebastian. I'm trying to get ready. Hold on. I'm going to try bending him back up again. The more I intentionally have his head bent up with this jacket, have his legs bent up to make it a little bit easier for him, because the more bent he is, the less he goes into all his extension tone. There we go. Let's try it with the tether ball. Sebastian, get tether ball. Gotta hit it, Sebastian. Great job, Sebastian. Right on cue. So, If I had a frame over him, it might be a little bit easier to hold this up. I'm doing a lot of this myself. But it's a good way for him to work on both hands together. In the past, I've done activities where he reaches with one hand or the other hand, but this is something by holding onto the stick that encourages him to reach with both hands. I hope this is an idea that you can use at home. Sebastian, you did super with it, and we'll look forward to seeing you next time. Thanks. Bye-bye. If you liked this video and would like to be notified by email
So you saw how in this video how we can help to such patients with different cerebral palsy, and what is very important that we should encourage them, and we should the physical therapist should make to be always exercises, always will be very interesting to them, because this is the children, and it will be more interesting as more it will be for the students, it will be more effective. A hypotherapy is a rehabilitation strategy performing with a moving horse, which has demonstrated its potential to improve the mobility of children with cerebral palsy. And this therapy is designed to improve motor functioning and quality of movement in children with cerebral palsy. The forms and shape of the horse and the rhythmic three-dimensional movements of the horseback riding improves the flexibility, posture, and balance and mobility of the rider. Hypotherapy can be described as low frequency, high repetition, and treatment strategy. And muscle contractions and postural position are required to react to the horse's movement. A full size horse transforms about 110 multi-dimensional swimming motions to the right each minute while walking. More specifically, in a 30-minute therapy session, a horse walking at a spread of 100 steps per minute will include over 3,000 steps. In order to maintain vertical alignment to react to these posture challenges, the child must engage their trunk muscles intensively. In most hypotherapy sessions, the child takes various postures. For example, forward sitting, side sitting, and backward sitting. During the sessions, the therapist and a trainer, a side walker, provides support and movement possibilities for the child sitting on the horse. In addition, it induces a scapular and pelvic dissociation in the rider, and similar to what is observed in a normal gait pattern with asymmetric arm and pelvic movements. Horseback riding therapy reduces abnormal tone, promoting motor performance, creating symmetric alignment, and improving postural awareness, gait, and mobility. It is a walk practice for the upper body without the use of legs, and one systemic review and two meta-analysis provide evidence that this therapy positively affects postural control, balance, and muscle symmetry. Session lengths range from 30 minutes to 1 hour without the frequency of ranging from 1 to 2 sessions per week. According to a recent systemic review, a weekly 45-minute sessions of the hypotherapy from 8 to 10 weeks was correlated with positive effect on a gross motor function in children with cerebral palsy. And the social functioning domain is influenced by various factors such as education. Next, it is social economic status, cognition of the patient's communication abilities, and the motor function. The opportunity to use or practice communication, listening, and language skills during this type of therapy also results in the improvements in social functioning. So this is hypotherapy enhance the children's motivation, willingness for the participation in an activity. So, what I want to tell you that this is all this type of rehabilitation which we can use in children with cerebral palsy. It's all help to improve the function of this children's and to increase the rehabilitation process. And as early as early intervention is very important, and as early we begin this is the rehabilitation process, as better will be for such patients. And to the end of our lectures, I want to tell you that this is cerebral palsy. It's very this is very important and long-lasting disorder, and as more effective and early it begins, is much better for the children. Many thanks for your attentions and goodbye.